Isabel Salazar, and I'm going to demonstrate the proper way to do a trauma assessment for my PH 49 class. So the first thing I do is arrive to the scene. I make sure the scene is safe, and I determine the mechanism of injury. In this case, it's a 24-year-old female who was involved in a car accident and resulted in broken ribs and a broken ankle. And I determined how many patients were involved. In this case, it was just one. And if I need additional assistance, I will call for more EMS assistance. And I'm going to go ahead and consider her. To stabilize her, so no more fractures or injuries can happen. So again, it's a 24-year-old female who was involved in a car accident and resulted in broken ribs and a broken ankle. I'm going to go ahead and determine her level of consciousness. So, hi.
Hi.
How are you feeling?
All right.
Okay. So she's alert. And she, what is your chief complaint right now?
Just rib pain in my ankle. Hurts
Okay.
a lot.
So she's determined that she's in pain, and that means she's alert and oriented. And with that, I'm going to go ahead and assess her airway. Since she's able to talk to me, her airway is patent. Go ahead and open your mouth. And okay, airway is patent. She's able to. Okay. And next, I'm going to go ahead and assess her breathing. She's breathing at a rate of 22 breaths per minute. And I mean, she's getting adequate ventilation. It's a little bit fast, but it's okay. She's probably just in shock for the accident. And with that, I'm not gonna go ahead and administer oxygen. She's still breathing regularly. And I'm gonna go ahead and assess her circulation. So I'm gonna go ahead and measure her carotid pulse. So just go ahead and turn your neck if you can. Okay, that's regular and strong. Regular and strong. I'm gonna go ahead and assess her skin for any change in her skin color. So her skin is dark, light pink. It's warm at touch, and I don't see no bruises or blood anywhere. But I don't see any. I don't see no bleeding at this moment, and I'm not going to initiate no shock management because she doesn't seem like she's in shock, but I will keep an open mind on that because that can happen later on. And at this point, the main priority is to stabilize her and make sure that she doesn't really move so that she doesn't get no more injuries. Okay, so with this, I'm going to go ahead and obtain a sample history because she is alert and oriented. So what are your signs and symptoms right now?
I just feel really my ankle hurts a lot and my ribs hurt a lot, and I just feel scared right now.
Do you have any allergies?
Yeah, penicillin.
Okay, and are you currently taking any medication?
Just was taking Advil, over-the-counter Advil.
Okay, and any past medical history that may be in concern?
No.
Okay, and what was the last oral intake you had?
I had them burrito.
Okay, and the event that led to this?
It was just an accident.
Were you driving too fast, too slow?
No. I was going at normal speed and they hit me.
Okay, so now I'm going to go ahead and assess her head and inspect for any lesions or masses. You feeling tenderness?
No. Everything feels fine.
Okay, I'm going to go ahead and inspect your mouth. Go ahead and open it. There's no blood. Your gums are pink and moist. And your face, there's no scratches or bruises. Do you have any pain in your face?
No.
Okay. And I'm going to go ahead and inspect and palpate her scalp and her ears. So, ears, there's no drainage or leakage. And assess her eyes. Go ahead and just look at me. I'll have a flashlight, so just look at the light. Okay. Okay. And then I'm going to go ahead and palpate her neck for any masses or tenderness. Do you feel any tenderness? I don't feel no masses or any lesions. And you do not have any jiggly or vein extension, so that's good. And then I'm going to go ahead and palpate her cervical spine to see if there's any injuries or any bruises there. So at this point, I'm going to have her turn to her side with assistance if needed. And I turn her to her side, and I don't see any bruises. Do you have any pain besides the ribs?
No, just
okay. And no bruises or lesions on her back. Good. Let's go ahead and go back normal. And next, I'm going to go ahead and auscultate her chest to listen to her lungs and her heart. Let's go ahead and breathe normally. to the heart. Okay, everything's regular. I didn't hear no crackles or wheezes or any obstruction. And then I'm gonna go ahead and inspect her abdomen and check for any abdominal distension or any pain she might have. You feel any pain? Okay, it's regular. I don't feel no bruises or lesions. Good. Okay. And I'm gonna go ahead and assess her pelvis. Do you feel any pain?
No.
Okay. And now, do you have any pain in your genitalia area?
Yes. No, not right now.
Okay, so no pain. Next, I'm gonna go ahead and inspect her lower extremities. I'm gonna go ahead and start with palpating her distal pulse to see if she's having circulation going down there. So, okay, it's regular and strong, so that means she has circulation coming down. I'm gonna go ahead and assess her sensory motor function. So with motor, go ahead and just close your. Right. Okay. So do you feel where I'm touching you?
Yes.
Which toe?
It's my big toe.
Okay, and just close your eyes. Okay. So sensory motor functions are intact. And I'm gonna go ahead and do the same with her upper extremities. So palpate for her radial pulse to see if she's getting circulation. It's regular and strong. Regular and strong. And this has her motor and her motor. So go ahead and just grip my finger. Her motor function is intact. And go ahead and close your eyes. Which finger am I touching?
My index finger.
So her sensory function is intact. Okay. And next I'm gonna go ahead and inspect and assess her posterior thorax and her lumbar area as well as her buttocks. So with this, like again, I'm gonna have her turn to her side. Inspect her thorax, the lumbar, no pain, tenderness?
No.
I don't see no lesion, no bleeding, and her buttocks is regular. And at this point, I'm gonna go ahead and obtain her vital signs to check to see if they're stable or not. So I get the readings, and her blood pressure is 95/68. Her pulse is 103. Her respirations are 22. So now that I know the baseline, I'm gonna go ahead and keep monitoring them every 5 minutes until we get to the hospital to see if there's any change. And at this point, there's no second injuries or wounds besides just the broken hip, the ribs, I'm sorry, and the broken ankle. And with this, now that we know, we're gonna go ahead and transport her to the hospital and just keep assessing her every 5 minutes, including her vital signs and just her overall consciousness. Thank you.